I have post-traumatic stress disorder because of my son. He's tried to kill me 6 times, but he is still my son. And I will support him for as long as he needs me to support him. Sorry, I get a little emotional talking about him.
This disorder was described in 1973, and neuropsychologists have been trying to identify the neurobehavioral phenotype of this disorder.
Individuals with FASD oftentimes have difficulties with certain cognitive functions that are involved in thinking into the future.
Areas of planning and reasoning and logic, memory and inhibition.
Mental health problems, birth defects, growth impairment, health problems.
Many of them have difficulties with impulse control, controlling the intensity of their interactions with other people, regulating their behavior.
They lack cause and effect. They don't understand if they go into a store and steal this candy bar, they could get arrested for theft.
You are 19 times more likely to be incarcerated in the juvenile correction system if you have FASD.
Having to deal with law enforcement when your kid is 6 years old is, no parent should ever have to go through that.
As a parent, it's heartbreaking because you watch your child suffer for so long and you're in it with them for so long, and then you find out that one piece in that situation didn't have to happen.
Alcohol interferes with a number of basic biologic processes that unfold during development.
There is no safe limit of alcohol exposure during pregnancy. So during pregnancy, you should not drink.
For more than 40 years, we've known that alcohol causes this damage to the developing brain and the developing organism. That part is settled science.
Even now, there probably isn't widespread knowledge about the potential risks of alcohol exposure during pregnancy. And certainly I do still hear from patients that they had been told by their obstetric care provider that small amounts of alcohol during pregnancy probably doesn't have an effect.
Every drink a pregnant woman holds in her hand has the potential to take potential away from that developing child.
Really, any alcohol-exposed pregnancy has a risk for developing an FASD.
If you can see that they're pregnant, they know that they're pregnant and they should do something about it, because then they get mad when they can't control their kids and it's on them, and then they don't find the supports that they need. And that's why our world is the way it is today.
They're labeled as the rebellious child or the child with the attitude problem. We're going on this path and this is where you're going to end up. You're not going to be successful. And it's hard enough if you hear that as a teenager, but when you have a teenager with a disability and nobody understands it, so you're misunderstood, that hits even harder.
Many of these children have been diagnosed as attention deficit hyperactivity disorder, and it has not been identified that hyperactivity is in fact related to prenatal alcohol exposure.
I first learned I had FASD around the age of 12 or 13. It was mistaken that I had ADHD, and I didn't really understand much about it at first.
The wrong diagnosis leads to the wrong treatment. If you haven't diagnosed FASD, it's extremely unlikely you're treating it appropriately.
The kid looks normal, so you have normal expectations for the kid. And then you treat the kid as if they're a huge failure when they don't match up to what you perceive the expectations to be.
People would sometimes think that I just don't want to do it or that I wasn't trying, even though I was. They couldn't really see it, that I just can't do it, and I don't really know how to explain why I can't. I just knew I couldn't.
The teachers, educators, and staff and administrators, because FASD is invisible, they don't see that what takes place as behaviors is a direct manifestation of this disability.
I just felt emotionally different. I had more meltdowns in class than maybe my peers.
I can't be punishing brain damage behavior. I need to change how I work in my school.
People can't see it. Even though your brain is permanently injured and you have deficits that challenge you every day of your life.
We're not missing the occasional person. We're missing virtually all people with FASD.
This is not some obscure thing that we're talking about, but this is actually incredibly prevalent.
If you look at the rate for autism, it's 1 in 43. And if you look at the rate for fetal alcohol, it's 1 in 20. That's according to the Centers for Disease Control.
The rates of autism are significantly less than the rates of FASD in the general population, but the funding and the awareness and the amount of research dollars that are going into the topic of autism are significantly higher than that's going into the field of FASD.
But autism spectrum disorder is not stigmatized. People are all aware of autism spectrum disorder, but alcohol is very different. The fetal alcohol syndrome is stigmatized, and mothers who give birth to babies with this disorder are even more stigmatized than are the babies themselves. So it's a horrible, horrible problem.
We should be concerned about it. It is costing us a lot of money. And you might go to the doctor someday and find out there's no room for you because it's full of people with FASD.
What we need probably the most in this field of preventing fetal alcohol spectrum disorder is awareness.
This is a complicated, complex, and confusing disorder. But what I can tell you, once you learn this disorder and understand it and a lot of the interventions around this topic, the knowledge can be used for almost any type of disorder.
He knows that he's got this disability where his brain is not wired right. And he says, you know, Dad, you have to keep telling my story. People like me should not be in prison. I'm not getting any of the help I need here. So he said, I don't want to come back here. And he said, but the only way that's going to change is if my story is told.